I wanted to ask if you've signed up to receive your vaccine yet, and give us a little bit of details about how Mount Sinai is, if they're ready and prepared to start distributing this vaccine.
Kristin, it's indeed a historical day, but it's also full with mixed emotions because as we are getting the vaccine, first one in the United States in someone's arms, in the same time we have a milestone of 300,000 cases. That's very grim. But going back to Mount Sinai and the question, if I receive the vaccine, first of all, I was a participant in Oxford trial, so actually I'm going for my second dose on Thursday. Um, Regardless, the hospital has sent us emails so that we'll be notified when our turn is coming. I was notified also that Mount Sinai Hospital received, as we speak, at 1 o'clock, the first delivery of vaccines. Keep in mind, they come in big packages. They have 90 seconds to unpack them and make sure they are stored at the right temperature. The pharmacy department is overseeing that, and they are assigning them in a hospital algorithm. First, it goes to intense touch points with COVID healthcare providers.
So, Doctor, you're actually the first person that I've had the pleasure of speaking with who's actually received this vaccine, or at least part of the dose of the vaccine. I'm wondering if you could tell everyone what that experience was like. We've heard news that some people had, really bad symptoms. They had a not so great reaction after they had the first shot. What was your experience like? Did you experience any, pain, fevers, aches, chills, or anything like that after you received at least the first dose of that vaccine?
Kristin, first of all, I don't know if I received placebo or not, and I was involved in another trial, not Pfizer. I was in AstraZeneca Oxford. What I hear from most of the people is that Pfizer might have a little bit more side effects than the other ones. I personally only felt for 3 days a little tenderness at the site of injection. But again, I'm not sure if I received the placebo or the real vaccine, as this is double blinded. So
I'm wondering how quickly and how effectively you think the United States can distribute this vaccine. How many people do you think we could have vaccinated by the spring, for example?
as per the head of HHS, Alex Azar, he is looking optimistically of vaccinating around 40 million people by the end of the year. And I'm sorry, 40 million doses, that would mean half 20 million people. And looking at 100 million people by the end of February to be able to open to the general population by March. However, this is a very optimistic expectation. Most likely, we're looking at the second quarter for the general population.
Who shouldn't take this vaccine right now? Can just anyone take it, or are there still some concerns, especially about children taking this vaccine right now?
Indeed, Kristin, there are a few groups that we don't have enough data. The fact that it's not recommended doesn't mean it's harmful. It just means we don't know yet. They agreed that anyone older than 16 is safer to receive it. Also, they are running sub-trials right now as we speak in children above the age of 12. So very soon we might have information on them as well. When it comes to pregnant or lactating women, the recommendation is to be discussed with the healthcare provider. They did have a few patients who became pregnant between the doses during the trial, and nothing has happened to them. However, the risk and benefits have to be taken at an individual basis, because what if a nurse becomes pregnant and she works in the ICU? That's a different story than someone who can work from home for the next 9 months. Another recommendation to avoid vaccine at this point is for those who are immunocompromised and those who have a history of severe allergic reactions. Again, those have to be decided on individual basis.
I feel like the one question I keep hearing, from my friends, family, just other people, is that they don't know what the long-term effect or impact of this virus can be, of course, because it hasn't been studied over the long term. I'm wondering how founded or perhaps even unfounded some of those concerns are. If you see anything in this vaccine that really might be dangerous, at least over the long term.
That's a great question. And to demystify all the misinformation out there about vaccine is going to be our next big hurdle, because vaccine hesitancy is severe virus on its own, and it can impact how much people will accept the vaccine. But answering your question, historically, most of the vaccine side effects occur in the first few days. There is no evidence yet there are long-term implications. That's number one. So we are totally out of the window when we look at these trial participants. So most side effects occur actually in the next few days after vaccination. They are mild. They're related to building and ramping up an immune system. And I would look at that as good news. That means, yes, I'm responding. I'm becoming immune. I would celebrate, actually. Just take one Tylenol and move on. But secondly, the concerns comes because they think that vaccine was developed in such a short time, and we don't know enough about it. But actually, this vaccine has not been developed overnight, has not been developed in the last 10 months. This technology has been researched for the last 20 years. So we have a lot of evidence behind what is new right now. We just took that technology and tweaked it to be applied toward COVID. So that's reassuring. Actually, it's not something completely new.
So, Doctor, I want to ask you about something that you actually wrote in your notes, which is that we cannot lower our guard right now. I'm wondering how bad this winter can get, especially as we do see some folks getting vaccinated against this virus. But we also, of course, have the holidays coming up. And I think people are really getting tired of the fact that they can't see their friends, their family, their loved ones, and are getting a little bit itchy, to get back out there and enjoy their lives. What is the danger if folks really start to do that going forward?
Kristin, this is really my biggest worry at this time, because we see good news on one side. It might make some people relax and lower their guard. And now we are heading into the most wonderful time of the year, and could become the most dangerous time of the year. The young people and those at risk, general population, they'll not see this vaccine in the next 2-3 months. And we're actually heading into a dark winter. The tunnel is long and it's dark. We have light at the end of a tunnel, but we still have to cross this bridge safely, make sure we're not falling off the cliff during this transition period.
All right, Dr. Luiza Petre, assistant professor at Mount Sinai School of Medicine. Thanks so much for joining us today.
Thank you.